Great. Hi, welcome. Thank you everyone for being here today. My name is Reanna Putnam and I'm the Community Engagement Specialist for the Citizen Science Association. I have a few quick slides about the CSA and some housekeeping notes, and then I'll turn it over to our moderator, Shanley, to introduce our panelists. The Citizen Science Association is a member-driven organization that connects people from a wide range of experiences around a shared purpose of advancing knowledge through research and monitoring done by, for, and with members of the public. Our efforts are concentrated into a biennial conference. Our next one will be in May 2021, a peer-reviewed journal called Citizen Science Theory and Practice, and member services such as our working groups, online networking, and webinars like these. Our membership represents the multidisciplinary and multidimensional nature of the field and includes project leaders, researchers, educators, and more. CSA members report that building relationships and connecting with others in the field is an important reason for joining, and our dues help contribute to the work that we're doing to create connections across the field. We've been so inspired watching members of this community mobilize around key challenges to COVID-19, such as supporting educators in distance learning through citizen science and compiling a list of resources to support COVID-19 research at home. CSA members are actively coordinating these efforts via Slack and in a dedicated Google list. I'll share links for how to join those conversations in the chat. Our working groups are one of the key ways that we work to advance the goals of CSA through the sharing of resources, best practices, and relevant information, both among group members, but also to the broader citizen science community. There are 9 working groups that explore cross-cutting issues like ethics, data and metadata, policy, evaluation, and more. Getting involved with CSA is a great way to make connections, grow as a leader in the field, and to help support the association. This webinar was coordinated by our Law and Policy Working Group. You can find more about upcoming meetings, view past webinar announcements, or learn about their Ask a Legal Question tool, all on our website. We'll share some links to that in the chat. We're offering several webinars geared towards citizen science practitioners in the coming months. You can find our past webinars on our YouTube channel, which you'll see here. We have lots of webinars this month geared towards helping citizen science practitioners hone their skills and make connections in celebration of Global Citizen Science Month. Members of our evaluation working group will be answering questions about citizen science evaluation and a member-only Ask Me Anything. And we'll also be premiering our new data quality resource compendium, and we'll have folks from the data and metadata working group there to answer questions and show you how to use this new tool. We have a book discussion, and then we have lots of things in the works, including some citizen science resources for educators, both K-12 and university, that are geared towards getting folks ready to using citizen science for distance learning. We'll have more on the COVID-19 response later this month. A webinar on building trustworthy data practices in early May, and more coming up. And so stay tuned for that. You can find out more information about all of our upcoming webinars and register for those on our website. Though this webinar was free to register, we encourage you to make a donation of any amount if you're in a position to pitch in. We believe that community-supported webinars, particularly those from our working groups and led by volunteers, shouldn't be paywalled. If you find value in learning in this learning opportunity and have the means, you can help cover the cost to keep these webinars free for those who can't pay. We are doing extra webinars this month in response to COVID-19, and your support is greatly appreciated. I'll be sure to share a link in the chat for that. Lastly, we are expecting quite a few on the call today, and we have everybody in listen-only mode. If you have any questions or comments, feel free to use the chat. If you can't find it, you can find it under the ... more sometimes. Please direct all your questions and comments to all panelists and attendees so that everyone can see what you're sharing. If you want to now, you can go ahead and introduce yourself, say where you're from, so that way our panelists can get to know you all a little better. And with that, I'll turn it over to Shanley, who's a senior fellow at the Nelson Institute at the University of Wisconsin-Madison and a leader in our Law and Policy Working Group to get us started. Thank you, Leah.
Wonderful. Thank you, Rihanna. And I want to emphasize that, yes, please text or donate some support to support these webinars. Rihanna and Jennifer Shirk and others in the citizen science community put a lot of effort into these. and it helps with provide the project management support for these webinars. I want to welcome you all today to, I think this is the 4th or 5th webinar of the Citizen Science Association Law and Policy Working Group. The coronavirus is an enormous national and local policy issue for all of us, and how we respond will determine how we fare. So the citizen science community, the open data community, the maker community, the serious games communities have come out in force to help responders with this effort, both from a research perspective and coordination of the response. So we're delighted today to be able to highlight some of those efforts and do a call to action. We hope that many of you will be able to contribute to these projects now and as we go through this experience together in the coming year. I'm delighted to introduce a wonderful set of panelists here today, but before doing so, I want to mention, as Reanna noted, we have some past webinars that you can find online. They've all been recorded and archived in the Citizen Science Association's YouTube channel. This webinar will also be, video will be archived, and as we go, we'll be entering links. Reanna is harvesting these links and putting it up in a Google Doc that you all can get to afterwards. So with that, I'd like to start with Dr. Jeanne Holm. She is a senior technology advisor to the mayor and deputy chief information officer in the city of Los Angeles. As a leader in open data, education, community building, and civic innovation, Jeanne has empowered people to discover new knowledge and collaborate to improve life on Earth and beyond, including space through NASA. From the astronauts in orbit to rural villages in Uganda, billions of people use her system to find the data, information, and knowledge they need to make better decisions every day. In addition, if that weren't enough, she's a distinguished instructor at the UCLA, a fellow of the United Nations International Academy of Astronautics, and a co-chair of the Africa Open Data Community. So with that, I'll hand it over to Jeanne.
Great. Thank you so much, Leah. I really appreciate it. And I appreciate everybody being here today. I know this is a really trying and uncertain time for folks, and that you've taken the time to try to learn from each other and to share what you've learned is really important to this community. So thank you for being here today. So I'm going to share a little bit about what we're doing related to our COVID-19 response at the City of Los Angeles, and weave into that aspects of how we're really working with our community and our citizen science groups. So there's a few things that you can imagine as a city that we're interested in doing. And the first and foremost of those is really making sure that we're keeping people safe. So part of our challenge as a city is making sure that in a expanded city, we have 500 square miles in the city of Los Angeles, 4 million people, and 500,000 businesses, all of which are clearly being affected by the current situation. In order to make sense of all of that and figure this out, we really focus on 6 things. The first and most important is improving public health outcomes, and we work that with the state and county. Like many cities in the United States, the public health sector doesn't stay with us. It's really a county effort, so it's a close collaboration, but a lot of the services come out of the city. We want to make sure that we keep our city staff safe and well. If we get coronavirus ripping through our staff, we won't be able to support the services that people are looking for. We want to make sure those services are up and running, and that we support teleworking and virtual public meetings. So many of the positions at the city can be virtualized, but there's a bunch that can't, obviously. When you think about it, you still need people to go to the zoo and take care of the animals. You still need people to fill the potholes in the streets. You still need people to go out and pick up the trash. So some of our positions can be virtualized. And then most importantly, when we start thinking about all of that sort of base, we really want to start making sure that the people of Los Angeles are being safe. And the vast majority of things that will make them safe is their own actions. So it's really essential that we provide up-to-date information for the public to keep them engaged on the safety plans and actions, and to do that in ways that also balance other things going on. Just this week, we launched the US Census, which is an incredibly important piece of content to be sharing and engaging the public around. But now we have these multiple messages, not conflicting messages, but we need to engage people and get them to act on the census while also acting to be safe. And then most interestingly, we really need to inform policy and the actions that we take as a city with data and predictive analytics. So I'm just going to highlight a few of these ways in which we're doing this. First of all, we saw this coming as we watched kind of the march across the world from China to Europe, and we realized it wasn't long before the US was going to be in the same boat. So in the city of Los Angeles, we have 48,000 employees, and we needed to virtualize those as quickly as possible. So a year ago, I oversee the 311 call center as one of the infrastructure activities that I manage. And a year ago, I virtualized that. So more than half our employees normally work from home. It was the first pilot effort at the city to sort of create a large teleworking organization. And it's gone really well. And that laid the groundwork for us to be able to create Connect to LA City, which provides teleworking support for almost 24,000 of our workers to be able to access the city systems and services that they need. So when we're thinking about sort of how to engage and work with this kind of an epidemic, we really need to make sure that people are able to get their jobs done. And as we look at businesses, how they also virtualize that. When we start thinking about reaching out to people, we want to make sure that they're getting the information that they need. And we engage the public in a variety of ways through this. So one is our 311 call center. We also have a mobile app that we get about 25% of our service requests through. And this has been really important for us during this COVID-19 piece because the public actually drives the data and the requests that then change the priorities of city services. So by calling 311 or by using the mobile app or going to the website and asking a question or a complaint or a compliment, mostly they're complaints and questions, then we're able to get a better sense of what's happening. And this has been really important for us during the coronavirus issue, partly because we want to understand what people are challenged with, what they're asking about. We heard a lot of questions early on about testing, so we pushed really hard on making sure we had testing openly and transparently accessible across the city, and we were very aggressive in making that available to anybody who needed it. And then we also heard a lot of businesses asking questions around how this affected them and were they allowed to be opened or closed. LA has been, like many California cities, has been very aggressive in sort of adopting a safer at home attitude. And so really encouraging and enforcing businesses to be able to close their doors and make sure that people stay safe. We also have a variety of social media that I oversee for the city and 3 television stations. So this also gives us the ability to engage the public. And we do this in multiple languages. So there's 220 languages spoken in Los Angeles. We push these materials out in a wide variety of those languages, and our 311 call center staffs about 120 of those languages. So we want to make sure we're engaging people in a way that's authentic and understandable for them. We're also doing some sort of light interaction around masking. So just this week, we've started to follow some of the new guidelines out of the CDC, which is encouraging people to wear masks whenever they're interacting with each other or out in public. And not the N95 mask, but the small facial masks. And because LA is actually the largest fashion hub in the country, we have 77,000 fashion jobs in Los Angeles. We started a social media hashtag to get people to engage in sharing the pictures of the masks they've created and how they're wearing them. And so it's kind of a way of giving people a little action to do and a way to kind of share and engage with each other. The other thing we realized is that as much as we want citizens to engage and participate, a lot of them are across the digital divide. And so we reached out to all of our telecommunications companies and really asked them to step up. And many of them really answered that call in an amazing way. And so we launched a new website last week called Get Connected Los Angeles. And this puts together all of the different initiatives across the region. And actually some of these services that we've put in are available for anybody in the country to be able to find the lowest cost internet where you are at, but also for LA school kids that are now all virtual, going to school virtually. And for hospital workers and for educators, there are free internet resources and low-cost computers available. This complements a couple of other programs we have called the Tech2Go program, where you can check out computers and Wi-Fi hotspots from our public libraries, and the R-Cycle LA program, where we do computer giveaways to low-income families and kids. So this was an important part of making sure that if we're going to get people to participate and engage around things, that we want them to be connected to the information that they need. And then, of course, we're really using data. So this is just some examples of some of the things that we are working with. And so this data provides a few different things. One is looking at the clusters and localization of the data. We want to make sure that we understand sort of where the hotspots are. And this has a couple of things. One is we want to make sure that people in those areas are getting access to testing, but that the hospitals in those areas are prepared for surge capacity. We also are tracking our active number of cases, which is that chart at the bottom, to make sure we understand kind of, are we flattening that curve? Are we ahead of where we need to be? Are we, when we hit that peak that everybody talks about, will we be under our hospital capacity so that we're able to get everybody to a ventilator and everybody to a hospital bed? We've been very aggressive about that, and we've converted our convention center already, and we have very few cases in relationship to other parts of the country. We've already converted our convention center to a hospital, and the U.S. Mercy Navy ship has come into port with an extra 1,000 beds. So we've prepared ahead of time for the kinds of issues that we expect to see. And then really working with the state to kind of track that hospital capacity and data. And we can't do this by ourselves. So actually, we've been engaging with our citizen scientists from the beginning on all of this. And part of that is through an organization called the Data Science Federation. So this is a collaboration we've had in place for 3 years with 18 universities and colleges across the region. And they've always been helping us with different city challenges and problems. And the students, professors come and work on these kinds of activities. Just last week, we did a virtual meeting with everybody, had about 80 participants from different universities and cities in the region, and put out a call to action around this. And so those groups are now forming around hospital surge capacity planning, supply chain management, so the personal protective equipment and other things that we know we need to get in place, and a few other data analysis projects that we're really working on. But this lets us now open up not just to people in the city staff, but really to lots of people. And because the Data Science Federation has been around for a while, we have that really active, trusted network of folks. And I'll just mention one of the projects that is kind of turning around because actually, oddly enough, of the COVID-19 crisis. So we recently won, as part of the Data Science Federation, a $2 million grant from NASA to study air quality. And this combines satellite data, Internet of Things data, and citizen science data based on using both citizen science around smart inhalers, augmented reality, gamification aspect for kids, and then other citizen science air quality measurement techniques that we're using. But this project, which was just started a month ago, has really taken a different turn now that we can look at how is the air quality changed dramatically when we basically stop the vast majority of human activity on the planet. And we've been seeing lots of graphs of how the air quality has improved, but it'll be very interesting to study this and to get our citizens engaged in this kind of activity and do it in context of the things that are important to them. So those are some of the things we're doing in Los Angeles, both to engage citizens, also to make people safer at home. And I hope that all of you are staying safe and well.
Wonderful. Thank you, Jeanne. We so appreciate that. We're going to hold questions to the end, but people can begin to enter their questions into the chat box, or particularly in the Q&A box, which is in your icon at the bottom of your screen. And we will read those questions to the panelists at the end. Our next speaker will be Dr. Dorothy Jones-Davis, who has very kindly agreed to be here, even though she's got other very pressing concerns with the response efforts, and Jeanne as well. So thank you, both of you. Dr. Jones-Davis is the executive director of the Nation of Makers, a nonprofit whose mission is to support America's maker organizations through advocacy, resource sharing, and the building of community within the maker movement and beyond. And I know many of our colleagues in the citizen science community have worked hard to try to build those bridges between the citizen science community and the makers, particularly like Darlene Cavalier, SciStart and ASU, but many others. In this role, she is deeply interested in creating connections between a diversity of makers, enabling to use their collective skills to harness solutions for the world's challenges. With a PhD in neuroscience, Dorothy has previously held roles in the National Science Foundation, the Foundation for the National Institute of Health, and the University of California, San Francisco. And we met in Washington when you were helping to lead the US federal community around making with your colleagues. So with that, I'll hand it over to Dorothy.
Thank you so much for that lovely introduction, Leah. So today I'm going to talk to you a little bit about what the maker community is doing in response. And I have one quick slide just so that I can keep myself on track and make sure that I'm mentioning all the appropriate people. So I'll share my screen in 1 second here. Just give me one moment to share. There we go. Okay, and we're going to go over here. All right, and then we're going to play. All right, so basically there's a need to address our nation's critical need for access to medical products and personal protective equipment that's happening right now. So a bit about myself. So Nation of Makers is a national nonprofit, and we support the maker community, and we do that through support of maker organizations. And you might be wondering, okay, what's a maker organization? In a lot of ways, it's a community science or making hub. So it's a place in your community where you can go and make things. These are maker spaces. There are other organizations that support and provide professional development to educators. And all of those organizations really sit under our Association of Nation of Makers. And so in the past week, which feels like a year to me, it's gone by so fast. Each day feels like it's much longer than it is. We're trying to think about ways that we can address the significant issues that folks like Jeanne are facing and other cities around our country are facing. And one of the number one challenges that we've heard, and we've heard this publicly, is that right now we're at a critical place where we don't have access to the medical products and the medical equipment that our first responders need. And so the maker community, without even, before we even got engaged in a formal way, had already started to pull together. And there were a number of maker groups that kind of were formed. There were a bunch of little small groups, sewing circles, that decided that they were going to make masks and address this issue immediately. There were a number of different makers that came from sort of different backgrounds, people that were citizen scientists and just people that don't even consider themselves necessarily makers but saw a need and wanted to fill it. But there are some formal groups that also got engaged, and I wanted to draw your attention to these, and I will make sure to put all of the links to all of these organizations and ways that people can get engaged in the chat after I'm done talking. So we have a number of different organizations that are represented. The two major ones are the Open Source Medical Supplies Group, which is also known as the Open Source COVID Medical Supplies Group, because they started out right now working, addressing the COVID crisis, and Helpful Engineering. Now, these two groups are groups of, a number of different people from different backgrounds, from the federal government, from just sort of the hobbyist maker community to engineers, medical professionals, physicians, frontline workers, anyone who wanted to pitch in. And I will tell you that the open source medical supplies folks in particular have about 60,000 people on their Facebook page that are part of their community, or the Facebook group as a part of their community. And they have rallied together within 2 weeks. They were able to deliver over 100,000 pieces of PPE to critical frontline workers. So this group, to give you a little context about how makers are actually doing this work, this is a group of individuals that come together. They're on both Facebook and Slack, and through a community practice very similar to the kinds of community practices that this group is used to, they've taken it upon themselves to self-organize, create a actual organization, crowdsource designs, iterate on those designs, get them medically validated, which of course is a very important step. So making sure that they go through a medical review process and a medical approval process that allows for physicians and frontline workers to actually assess whether or not these wonderful, helpful technologies can actually be used. And then once they're medically reviewed and vetted, they go through towards being published and for the community to make. Similarly, Helpful Engineering is also a group of probably close now to a similar size of similarly minded individuals. And I will say there's probably a significant amount of overlap between the groups that are also doing a similar thing. And they've been focused mostly on face masks, in particular some of the 3D print technologies, whereas the open source medical supplies folks are doing a number of different things as it relates to gowns and also, you know, face shields and masks. And so what's happened is that these groups, these grassroots groups of makers have come together in this, you know, responsive way to address the need. And then we have been partnering. So Nation of Makers, how we fit in is we've been partnering with all of these organizations, including an organization called Get Us PPE. And that particular organization has been trying to get frontline workers any personal protective equipment that they can. And so that can be donated personal protective equipment or fabricated personal protective equipment. And so Nation of Makers is very proud to serve in sort of the leadership of the maker side of things on Get Us PPE, and that's at getusppe.org makers. And so that link is right there on the slide, and I'll also make sure it goes into the chat. And so on that page, an individual can go and they can find validated designs. They can join our community of different practitioners that are doing making. They can find a design that they want to fabricate. They can get the instructions on fabrication. And again, these are all medically reviewed and approved designs. So these are designs that we think will be the most helpful and the most safe, given that they are still fabricated for our frontline medical workers. And then they can go back into our system and let us know that they've fabricated these things. And then we have a system to get them out to the PPE, out to the frontline workers that need it. And so it's a pretty remarkable system. And the one thing I will say, you know, is that I have great faith in my position, in this position, as to the amount of citizen responsibility that happens in the world. I've always been an optimist about what the everyday person can do. But I will say that COVID-19 has really brought to light the true magnitude of that power. And I think I was talking the other day to someone within the federal government, and we were having a conversation about the fact that, you know, the maker community really has risen significantly in the past few weeks to the challenge of meeting this sort of ever-evolving critical need for our personal protective equipment. So I don't want to belabor things too much. I will mention one more partnership that folks may want to be aware of. We're proud to also be pointing to the efforts of the NIH, the FDA, the Veterans Administration, and also America Makes, as they also partner with the maker community, specifically as it relates to 3D print designs. And so now if you go to any of those, their front pages, you can be linked to their maker efforts. And also we're proud at Get Us PPE Makers to be able to display those additional level designs that have been not only medically reviewed by physicians in the field, but also reviewed by an NIH medical review panel or FDA or VA, and they have the appropriate guidelines so that we can all be safe as we're fabricating them. And I'll be happy to take questions. I do apologize, as Leah said, I've been so much on the front line, I have not had an opportunity to prepare the kind of slide presentation that I normally would, but I am so grateful to be here to be able to share this great information with you guys.
Thank you, Dorothy. And I've been on that Facebook page for the maker, for the PPE, and it is tremendous. As you say, this is citizen science or citizen engineering at its finest. They are looking at the scientific literature, determining what are the best designs, iterating on them, as you said, and going through the rigorous vetting process before deployment. So it's been a phenomenal effort, and I would love once things settle down to get maybe a debriefing on what are the lessons learned out of that. So with that, we will go to the next panelist. But before we do, I want to comment that people are adding links to their projects in the side chat. Be sure to check out, looks like the SESH team in Europe is crowdsourcing stories of generosity in a time of coronavirus. And Tiberius Ignat from the EU has talked about tracking misinformation and how do we combat that through crowdsourcing efforts there. So do look in the sidebar chat for projects that people are sharing, and add your own, please. So with that, we will move to Dr. Jeremy Auerbach. He's a postdoctoral research fellow in the Department of Environmental and Radiological Health Sciences at Colorado State University. He's got formal training in applied mathematics, evolutionary biology, and geospatial information science, which is awesome, and has experience working on projects for social good by using quantitative methods to develop evidence-based policies. He's currently working for urban community organizations to address health disparities, housing and environmental justice, and transportation accessibility. And Jeremy has also led several collaborative writing efforts in the citizen science community to help define different aspects of the field. So with that, I'll hand it over to Jeremy.
Thanks, Leo. Yeah, this usually is my purview, but I wanted to talk a little bit about an ongoing project that we have in Denver and see if it gets get a little feedback from the participants today and highlight what we're doing out here. So currently in Denver, Colorado, and I'm more of a community engaged researcher. I work for community organizations and try to provide technical assistance. One of the projects we have going on is trying to help understand the health of residents in a public housing community in Denver, Colorado. It's the community called Sun Valley, which is downtown, and it's located near some major highways and some industrial sites. It's historically been marginalized, very poor area. I think the last data we saw on economics is that the average income for residents in the neighborhood is less than $10,000. It's primarily refugees and immigrant families. And they suffer a lot of health outcomes, and there's a big health disparity issue in the neighborhood. What we're doing is we're looking at possible improvements of their health as they transition from older 1950s style townhome that are basically dilapidated. They lack central heating and air. They are just in shambles. There's pests, there's sewage issues. And the Sun Valley neighborhood and Denver Housing Authority has won a large HUD grant in conjunction with the EPA to upgrade this housing to apartment style, mixed income, mixed use. And we'd like to see how the health of the residents improves during this transition and ultimately when they move into the new housing stock. But that's been interrupted with COVID. And one of our projects that we had going on was a photo voice program where we were having training residents and having them document their environment, their built environment. So we were trying to have them focus on the health impacts of what they observed in their environment. And that we had begun that about a month ago, about 6 weeks ago, getting residents' cameras and spinning them up on taking pictures in their neighborhood and their homes. And like I said, that was been interrupted by COVID. We only had 2 families so far that were able to turn in photos. So now we're looking at how we can transition to documenting, having the residents document their experience under this pandemic, living in this public housing. The environment that they live in isn't really suitable for any long-term stay. There is very limited access to resources in their neighborhood. There's no nearby a grocer, for example. There's a 7-Eleven down the street, but that's about it. There was a community kitchen that started a couple years ago, And they have been, it's an amazing organization, nonprofit organization, and they have been donating food. So they use their profits to purchase food, and then they donate that food twice a week to residents in the community. They've had to scale back that operation considerably due to COVID. They have lost a lot of revenue, and they can't afford to be purchasing food. So the residents are really in a horrible situation right now. And right now I'm trying to, the team that I'm part of, we're trying to figure out ways that not only can we help them directly, but also document their experiences so that in future situations like this, we can develop programs and policies to assist.
Great. Okay. So did you have any more to add to that?
I don't.
Okay, great. So we'll field questions about that effort and how people might get involved at the end. Thank you, Jeremy. Greatly appreciate it. So with that, I'd like to introduce our last speaker, Dr. Sophia Liu. She is the very first innovation specialist at the U.S. Geological Survey and is working with the Science and Decisions Center. She's also one of the co-chairs of the Federal Community of Practice for Crowdsourcing and Citizen Science, which is about 350 people strong across the federal government. And the CCS coordinator, or the Citizen Science and Crowdsourcing coordinator for the USGS and the Department of Interior, which is a pretty big role. During her USGS Mendenhall postdoctoral fellowship, she conducted crowdsourcing, citizen science, and civic hacking for the National Earthquake Information Center. So with that, I'd like to hand it over to Sophia.
Thank you very much. I appreciate the introduction. I probably could update that slightly, but I'm very excited to share some of the work that I've been seeing in the area of what I like to call more open innovation that includes crowdsourcing, citizen science, prize competitions. And there's just been so much opportunity that's occurred just in the development of technology that's made this much more quick. But also just how people are very interested in helping. And something when I first started at looking at this during my graduate studies at University of Colorado Boulder, we always saw a wide variety of folks want to help. I think there's something that you could do with donating money and often blood, but really there's so much more opportunity that we're seeing. And that's what I started to notice over the years, over the past 10 years, how as the technology evolved, it allowed people to really leverage the opportunity of digital volunteerism and different ways we can help, both using the technology to be able to coordinate, but sometimes a lot of this was about how you could engage with folks, leveraging the technology online, but also being able to meet in person, provide masks in the case that was spoken earlier. So as COVID-19 was starting to occur, I was actually in the process of trying to help finalize this prep talk that I gave back in September. And so it became pretty relevant as we were starting to see so much crowdsourcing and what I often call curation of this effort. So I highly recommend checking it out. It's kind of neat that right on the FEMA homepage, it's actually mentioned right in as the third option there. And there's actually discussion materials with some COVID-19 resources as well that we provided. And what I realized in when I first started looking at LinkedIn, I came across Leah's posts actually, and what ended up happening was I just started to leverage the curation of other folks like Leah and other crisis mapping friends and colleagues of mine that were posting information on these social networks. And over time, I just created this wide variety of compilation of different links, both of the interactive dashboards that we noticed and maps that were starting to emerge aside from just what the Johns Hopkins and the World Health Organization were creating, but we saw so many other of the sort of unusual players in the spontaneous efforts. For the work that I was doing, I just wanted to see, you know, what extent were there different kinds of open innovation efforts, such as the challenge competitions and hackathons, also the citizen science crowdsourcing and open science efforts. And I also want to include here the open source efforts as well. There's a lot of use of GitHub and developing dashboards, and so this was an opportunity for them to leverage all the open data that was increasingly being shared on COVID-19 on a variety of levels. The other piece in terms of coming from a federal science agency perspective is that we wanted to also see to what extent the challenge for various teleworking parents had in being able to have kids at home and making sure they're still getting education. And so we've been trying to think about what kinds of citizen science projects that might be good to target. And so over time, we've seen various federal agencies as well as organizations like Citizen Science Association share a variety of projects that are really good for targeting at kids. SciStarter has also been a great platform where you can sort of narrow the projects that are for a specific age group. So I think it's a really great opportunity to get out the value of how as these kids are having to learn from a distance, how they can actually be learning and contributing to science. So as I was looking at a variety of different kinds of efforts going on, this was something that was developed by a Stanford master's student, and it's a video, and it's a much more interesting as a video. It's actually data sonification. So he does a good job of being able to make a sound every time there's a new data point, and just a really good example of using both visual and audio as a way to communicate information. And this is just a little bit more. It's called Hear the Sound of Coronavirus Spread to 89 Countries. And what I really want to point out here is that sometimes people often mention how could they trust, you know, data from the public? And this is often a common concern or remark from skeptics about crowdsourcing and science data. But, you know, this is just another example of how this person provided the data sources, really tried to explain how he came about developing this data visualization. And we see this across various other realms of work in crowdsourcing curation. And he even pointed out how, I think this was a really good video of how a TikTok user stole his video. And so I think there's a really important piece of recognizing the volunteers that just push this stuff out there and attributing to this information to those folks rather than stealing videos. Now, I just want to give you a quick set of examples, but really excited to just have a discussion with folks that are on the line here. But there's a variety of efforts in the federal government happening. NASA's done a really great job with their NASA at Work platform, where they are basically tapping the workforce for their own innovative ideas of how they would approach some of the really important grand challenges happening around health medical kind of issues, such as the personal protective equipment, PPE, as well as ventilation devices, and just thinking about how can you bring together various folks about various types of engineers, even a wedding dress planner we've seen in the past as being able to develop a really great design. So why not leverage our own in-house efforts? So that's something that I think is really valuable that we're increasingly seeing in the federal government. Challenge.gov has also been a place where they help house and centralize a lot of the federal oriented prize competitions and challenges. So this was a more recent one by MIT that was sponsored by the Department of Veterans Affairs, and building a variety of solutions in part to protect vulnerable populations, as well as on helping health systems. There's been a variety of others, so FDA's efforts in connecting manufacturers and healthcare entities. So this is a collaboration both with FDA, Department of Veterans Affairs, NIH, the National Institutes of Health, and America Makes. So I know that was probably mentioned before, but this is just a really great example of the importance of public-private partnership, and something that I think in the federal government we're increasingly needing to do. There's a lot of crowdsource efforts and data within the industry, and it's increasingly more important that we leverage that opportunity instead of trying to kind of recreate the wheel in-house. There's also this other prize competition that was through the New York Academies of Science that I thought was pretty interesting. There's really a whole ton of other efforts. And so I'm just going to stop there because I think there's just a lot of potential interest to just have a discussion around the variety of open innovation efforts already happening. So thank you so much, and my apologies for the technical difficulties.
Awesome, thank you, Sophia, and no worries. We know everybody's got a lot on their plate right now with the response efforts, and we're just glad to have you and have the information you've provided. While people were talking, there have been several fabulous links that have come through, a lot around what the VA, FDA, NIH are doing and America Makes. Also FEMA's crowdsourcing unit. I'd like to ask Katie if she can unmute her mic just briefly to add a comment to what Sophia said about the FEMA core response.
Yeah, Leah, give me just a second. I'll have to do
Okay.
that on my end.
Oh, will you? Okay. Sorry, I should have emailed you. And then also Reanna had some comments to make quick too before we transition to Q&A.
Great. Katie, you should be able to turn your mic on now if you want to.
This is Katie. Can you hear me?
Yep.
Awesome. So I'm actually part of FEMA's crowdsourcing unit, which is different from FEMA Core. FEMA Core is FEMA's volunteer program. It's for it's sort of like AmeriCorps, and it's young people who want to take a year or two to volunteer with FEMA. I'm happy to provide some resources on that if anyone's interested. But FEMA's crowdsourcing unit is it's fairly new. Sophia actually helped us get started up over the last couple of years, and we now have 2 full-time people, myself and my colleague Kim Stevens, and we support. We're a steady state unit, but we also, our main role is during activations for disasters, including COVID-19. Our role is to coordinate with external groups who are doing crowdsourcing and citizen science activities that are, related to responding to disasters. So, we coordinate. Traditionally, we've coordinated with groups that are crowdsourcing information, and FEMA has traditional channels for collecting information and for reporting and all of that. But we found crowdsourcing to be a really valuable asset for informal information, that can sort of help fill in the gaps sometimes. And so, we oftentimes we find either well-established groups that do crowdsourcing and citizen science activities, or sort of like we're seeing now, there are a lot of groups that are forming in response to the disaster, they form in response to disasters and, are forming now in response to COVID-19. And so, we try and create a forum where these groups can coordinate with each other, and, where it's relevant or beneficial, we'll also build connections internally as well. So, if anyone on the call is interested in connecting, I put my email and a short description of the crowdsourcing unit in the chat. It's just FEMA-crowdsourcing at fema.dhs.gov. You can also get to us through Sophia. Thank you all for the amazing projects and hard work that you're doing. And thanks to everyone who's helping respond.
Wonderful. Thank you, Katie. And yeah, this is a call to action. We need people to mobilize and participate and contribute to some of these, to all of these projects that are being listed. I see we have a first, well, actually, I should let Reanna do a quick comment.
Yeah, thank you for everyone for sharing today and for sharing your resources in the chat. I've been busy copying and pasting and building a list of everything that's been shared today, and I'll share that in an email along with the recording to this webinar either later today or early next week. So you can look for that. I just shared in the chat a couple of ways that CSA has been working to coordinate response, citizen science response to COVID-19, that is. We have a dedicated list that you can join, an email list, one that's specifically for educators. We do have a group of educators who are working to create a series of webinars geared to different audiences, university, K through 12, and even home educators, parents who are new to using citizen science. And so if you want to get involved with that, be sure to join one of the lists over there. We also have a Slack channel that kind of combines all of these things. And again, thank you to everyone. And you can also find the list that CSA has of resources linked in the chat now.
Wonderful. Thank you, Reanna. Thank you for your hard work on this. So moving to questions. Nikki Chester wrote in the Q&A box, and if you scroll to the bottom of your screen in Zoom, you'll see there's a little Q&A folder with a little Q on it. So you can click on that and enter your question. You also can put it in the chat box on the side. So Nikki Chester asks, we have access to 3D printers and we have students already printing 3D printed face shields and masks. Can you help me through the process of getting these medically approved for use? I don't know this process. We think we can make 20+ masks per day at our school. So Dorothy, maybe we'll start there and then others can jump in if you also have information.
Yes, this is a great question and one that we always get. So this is awesome. So basically, if you have a design that is not coming from somewhere else that you've designed yourself, and I will throw it into the chat, there is a link that we're asking people to go to that links to a form. And I apologize, I'm also getting a delivery right now at a weird time. That takes you to a form that allows for your design to be validated by our medical review team. Now, if you're already printing from something, a design that already has been validated, so let's say one that you find on Get Us PPE/makers, you actually already have a design that we feel is what we'll say is medically reviewed. And I want everyone to understand, because, and this is for liability purposes, that these are all, still, they're not going to be the same quality or rigor as something that's made in a manufacturing facility that has all the QC and everything. But for example, if you wanted to then go to take that batch that the students or yourself have made to a hospital, you then can say, here is the design that I used. And what we're recommending to folks, and we have a script on Get Us PPE/makers that allows you to have some language that you can use when you print out and put your package together. So in other words, if you have a bag of masks, for example, we have a handy dandy printout that reminds you to list, what is this made out of? How did I make it? Ensuring basic things. Just as an aside that's related to this, I want to say that one thing that we do have also on that page are guidelines to get started. So while we appreciate everybody doing their work, one thing we will say is we want people to try to have the most sterile environment possible, especially if you're trying to bring these to hospitals. And that if you're not able to create the most sterile environment and you still are able to produce these, and that you did follow the guidelines and everything, we ask that you also consider other facilities. So a lot of people are contacting our hospitals, but we do need masks also to be given to places like homeless shelters. And we've gotten requests from homeless shelters and from a number of different other types of first responders, police units, folks like that who are also in close contact to people. So I encourage people as they make these things to also consider other places that they can also be delivered to. So I will put in the link for validation in 1 second. Let me just grab it.
Awesome. Thank you, Dorothy. And I want to mention, so I reached out to my local hospital, and they have an approved face mask design that they'd like people to use. There are a couple of, at least 2 or 3 hospital approved designs that you should notice. What folks are doing in the hospitals is they're putting some of these cloth masks over their N95 masks so that they only have to wash the cloth mask and can reuse their N95. So keep that in mind in size. It's good to reach out to those hospitals or those centers that need it to find out what they're looking for before you make them. There's also, the maker folks have put together a list of the scientific literature on masks and what fabrics are better for keeping the micron-sized viruses out. So keep that in mind. I found it a bit frustrating myself when I went to Joann's yesterday trying to find those fabrics. They're overloaded. They're not really prepared for it. So keep that in mind as you go through this. Any other questions for Dorothy? Type them in this box because we want to make sure we get those. We have another question from Joseph. He asked, and this I think is a fabulous question, and perhaps it might be good for Jeremy to start with it, but Jeanne as well. Joseph asks, so exciting to see these resources and crowd power in action. Love it all. I'd be interested to hear if people have been working on domestic violence reporting and responses. It is increasing in many areas, and would it be well suited to crowdsourcing? So anybody want to take that? Jeremy, Jeanne, others?
So I'll take on some of this. I would be really interested in seeing ideas around helping the fact that in this case, where I tell people to be safer at home, sometimes they're not safer at home. And sometimes they don't have a home. We are in the midst of housing 6,000 people into our recreation and parks centers right now, which is a massive effort. And we are trying to make sure that we do that in a way that's dignified and supportive. But the issue of domestic violence is one which is really important and can cause people to make some really tough decisions because they aren't safer at home. So it'd be lovely to work with you on that.
Wonderful. So Jeanne, maybe you could provide in the chat box your email there, and you can get people in touch with folks that are working on this issue. Let's see if we have any other questions. While I'm waiting for other questions to be submitted. Oh, question for Jeremy. So I'm afraid I can't read the name who asked it. I apologize for that. But for Jeremy, do you have a website or a Twitter account? How can people plug in to help you with this research effort that you've proposed?
Yeah, I can put my email on there. We don't have a website for it, but that's a great idea. We should get a website going for Sun Valley.
Okay, so maybe you'll put your email there and people can reach out to you directly. Following on the domestic violence question, Leslie Wilson asks, how do you crowdsource domestic violence issues without endangering the people reporting or violate privacy issues? So yeah, there's big ethical questions there and how to do it. And Jeanne, maybe you want to offer, but there may be somebody else who also is an ethicist or can comment on that.
Yeah, I think there's certainly you don't want to share PII or medical data or people's personal information. But the challenge, I think, is really how do we help people who are now asking to shelter in place or stay at home? How are we helping them get access to the services that they need? Maybe they didn't, maybe it wasn't as acute as before, and now suddenly they do. So we work closely, for example, with Crisis Text Hotline, which is an amazing organization. We have our 311 call center. If people call 911 and hang up, a police officer will go and investigate anyway. So there's other things, but I don't know that everybody knows these things. And so I think the way to crowdsource some of this isn't necessarily to help an individual person get better services, but to help that whole group of people get access to better services, but communicate it in a way that's really reaching them and that's reaching them safely.
Excellent. Anyone else want to comment or? Okay. So Kate asks, so one of the discourses happening in Europe in the age of GDPR, so the new privacy legislation, how do you do this without marking people or regions? So how do we begin to collect this data, track if people are social distancing, et cetera, without infringing on personal privacy? Could this become one of the new predictive policing challenges where spatial data has become proxies for socioeconomic or personal data?
I'll take that up initially. Look forward to hearing what others will say. Yes, this is something that I've really been interested in trying to understand and explore, because when I first started to hear about how we can leverage mobile phones, it was after the Haiti earthquake, and the cellular phone companies were really willing to share the data there, of course in an anonymized, aggregated level, geospatially, but it was a really good way to understand and predict where the cholera outbreaks would occur. And so I think, to me, that's always been something that would be very valuable type of data, as long as there is this balance of privacy, but recognition that unlike, we all know that any major companies like Facebook, Google, the ones that that all appear on our phone, but we might not all be using it. Like some might have an Apple phone, some might have an Android, some might not have Facebook, but they still are collecting a lot of data, and they still have been able to look into population movement and how does that inform evacuation routes, or how they can collect information on connectivity. So there's a lot of great information, but the need for transparency of collecting it and sharing that and making it available to those that are actually the ones sort of almost providing it as well, I think is really valuable. So I've seen now that there's a lot of, you know, China has already started to collect on this information, and figure out how you might want to, in some ways, mitigate yourself from being exposed, knowing those around you. And so I think it is a tricky balance, because I know there's some efforts in leveraging this data, and I think there's a lot of opportunity to have it be open data in a sense of how do we all agree upon sharing this and leveraging it together, as opposed to it being used sort of behind the scenes without really recognizing that it is being anonymized, it is being aggregated, and that we all can leverage it for our own benefit. Even Taiwan had developed a open source project where I guess they did kind of know who were the ones that were confirmed positive, but there was this app that allowed you to just put in your own information and it would help you track it. They wouldn't download any of your own location data, but at least you had a better understanding of how much at risk you are based on your own location.
Very interesting. Maybe you could add that link to that
Absolutely.
analysis. That would be really useful. I've got a question for Jeanne, following on to this. You mentioned that the city has previously used citizen science. What kind of policies or procedures did you need to put in place? What were the concerns city officials and staff had in using citizen science that may, you know, touch on the privacy issues or touch on the security issues of the residents of your city?
Sure. So we use a variety of anonymized data, like from Waze. We share data with Waze all the time, the traffic app, and we're actually sharing data with them right now, because what we're trying to understand is, of course, traffic is down everywhere because we have a safer at home, but we're also trying to understand where people are congregating where maybe they shouldn't be. Are there businesses that are open? And so we're using that anonymized data to then go and send a police unit to investigate what's happening. Just last weekend, we actually got a huge shout out on social media for our LAPD, which doesn't always get positive shout outs. And because they broke up a 1-year-old's birthday party, which doesn't sound like a good thing until you realize there were about 100 people gathered together for it. And so the idea was, you know, we should probably not be doing this face to face. And so what we have done is we've drafted a code of ethics for the city. It's essentially a digital bill of rights, which guides our internal developers and our vendors in how we want to make sure that we're protecting people's individual data, and then making sure that when people share data with us, that it's also anonymized or scrubbed for that kind of information. So we take it very seriously. We believe that the city has a sort of sacred trust in making sure that if we do gather that data, that we don't share, like on tax data, we don't share that with anybody. And that in some cases, when we gather data that could be used later, we flush that data. So we gather data, for example, at our traffic intersections and do an AI counting of bikes and pedestrians and scooters to be able to give people more time to cross the street. But we understand that facial recognition could be run against that data set, and that's not the intended use. So we actually flush that data once we have it for its initial use.
Wonderful. Panelists, do you have questions for each other in this process as you're listening to each other talk about their projects?
I mean, I'm just personally excited to hear about all the different efforts, and just am happy. I would love to work with all of you after this call to kind of make sure that we're, you know, mobilizing people appropriately, and that we're enhancing the efforts that are already going on in all your respective areas. So I'm just looking forward to future collaborations. I wrote down a bunch of notes that I need to follow up with. So
that's exciting, Dorothy. I think we'll definitely reach out to you, and maybe there's some really easy ways that we could be collaborating between your association and our association. Yeah. Sophia.
One thing I wanted to say is I'd be curious to know if others have started to look at this, because a while back I started looking into how if you look at Google Maps, and basically it's Google My Business, but it's the busyness data. So how basically the popular times, and sometimes if it's a fairly large business, or if they've worked with Google, then they will have real-time data of how busy they are or how not. So on a personal level, it's been a good, useful way of knowing when I really want to go to the store or not, basically when it's not as busy. I don't want to actually be around as many people. because I know there's been challenges with going to grocery stores. So that to me is another really interesting example of how do we leverage big data and data from private sector companies. And I think that's what has been great. And I'm glad that Katie Piccioni from FEMA has been able to share a little bit more about the FEMA crowdsourcing unit. I actually had a slide, but my computer crashed, and then so it got removed by accident. And so I'm glad that you gave that introduction, because the opportunity to work and initiate the FEMA crowdsourcing unit helped me understand the importance of private-public partnerships and how we really need to leverage what's already there. And one idea that we're exploring at the U.S. Geological Survey, and maybe in trying to partner more with you all, is, and those also listening in, is we're trying to leverage, how do we create a win-win situation of potentially employing the unemployed? There's literally, I guess they said 6.6 million unemployed people from yesterday's count. And so that's a lot of folks, maybe just only a short period of time. But how do we leverage the variety of expertise? So you got makers, you've got folks that I think have all sorts of skills that we can all leverage. Folks that are maybe on the trails that would help our national digital trails data set. So I think there's just a lot of opportunity. I'd love to explore how can we create a better partnership and leverage the amazing talent and those that are just really all in an unfortunate situation right now, and how to bring all of us together economically as well as in a safe way.
Fantastic. I see one last point that I think is really important to highlight. Mariana asks, thanks much. This has been great. In the future efforts, as we get more clarity on COVID-19, do you think it's possible to have a conversation focused on rural areas, less densely populated, weaker health services, etc.? How do we respond as a citizen science and crowdsourcing community in these contexts? And I'll ask you all panelists, is there anything you'd want to add there? But this definitely is something we should perhaps talk about going forward.
I mean, I know one thing I will say is that that's actually the shift in our focus. So at Get Us PPE, I know that's a big conversation we've been having. And I think because of the way the patterns are, so rural areas are certainly, starting to have more cases, and obviously things are ramping up. And while they didn't ramp up as fast initially as larger areas like LA, like California, we're starting to see more cases. And so there was a little bit of time that we had to kind of harness the sort of crowdsourcing of the maker community in those regions. And so we did reach out to them sort of proactively, trying to get them engaged and understand. I think the challenge becomes actually, and this is a larger sort of policy question around, how do we, our understanding as a community, as a larger community of what's really going on, and how easy it is, I think, to think that something's not happening in where you live. And so the seriousness with which people have taken this pandemic to heart is really related to the number of cases. And so when you have cases that are not as frequent, those areas often are like, oh, but that's not our problem. That may be LA's problem, or that might be New York's problem. It's not our problem. And the reality is it is. So I think there's been a challenge with communication, but I do think that that's something that we're really thinking about, because we know that there are significant challenges, even if you crowdsource everybody, in delivery of the types of materials and equipment that at least our group is right now concerned with. And those hospitals are, in fact, the less resourced hospitals often in an area as compared to their larger city counterparts. And so that's something we definitely are very, very concerned about. So I agree, that's a conversation we should definitely continue to have.
Fantastic. I completely agree with you, Dorothy. Right now I'm in a little town of 16,000 people. So our count is 32, right, cases confirmed, but there's 400 people that are waiting for test results, and everybody here thinks, oh, that's not a problem here yet. So really, how do we communicate and how do we engage people at those kind of level communities is spot on. Jeanne, Jeremy, do you want to jump in there quick?
Yeah, just real quick. Yeah, so we've got a side project where we're looking at wildfire exposure on livestock in Colorado, and this is primarily in the rural regions. And I've seen some parallels to when I work with marginalized communities in the urban environment. There's significant communication disparities and barriers, and especially when it comes to science. in my work, dealing with people of color in these marginalized and these communities in the urban environment. But we're also seeing something kind of similar working with folks in the rural areas too. And I'm just starting to think, maybe we need to have some sort of cultural sensitivity training for rural residents and rural folks that citizen science project coordinators, work with.
Jeanne?
Yeah, I was just going to jump in. There's two interesting indices that play off when we think about rural areas. One is the transmission index, which is how quickly does this get transmitted amongst a population, which is worse in places like New York and Los Angeles. So it's easier in rural areas where there's less human-to-human interaction. But the other aspect is susceptibility, and that really plays against socioeconomic, broadband access like we talked about, the ability to get information online specific to your area. And so when we think about those two things that play with each other, the rural areas in some ways are more susceptible to the risks associated with COVID if they don't get the information they need and access to the services that they need. I don't have the solution, but I am very compassionate about the problem.
Wonderful. And Sophia, we'll let you have the last word.
Yeah, I'll just say I think there's definitely some data out there that I think we could collect, like what is the connectivity from various companies. Even Speed Test, their website also was starting to track the variation, although I'm not sure if spatially they've been able to do that. I know there used to be an FCC Speed Test app that I'm not quite sure if it's being activated right now as much. I think it's still running, but I think there's a lot of opportunity, and that we really should think about how we engage the rural folks in different ways. Even in Colorado, I think there was more of the testing of the plasma, the antibody kind of testing, so a different kind of approach. When you have a smaller group, there might be opportunities rather than challenges that are worth leveraging. So thank you for the opportunity to speak here.
Yeah, fantastic. You all did a tremendous job, and I particularly am also excited to see how many of the participants have contributed links to their projects and have asked just fantastic, very insightful questions. Want to mention before I hand this back over to Reanna that we have another webinar planned for April 24th. We've got representatives from Foldit, Eterna, Safecast, and the COVID Near You, which is formerly Flu Near You team, will be presenting on April 24th. So look for that announcement. And I want to thank you all, and especially thank Reanna and the Citizen Science Association for their hard work in helping us to put that together. Lastly, the Citizen Science Association Law and Policy Working Group. We've been organizing these webinars every month, and would love to have you join our group and contribute, and we'll provide that link as well. Reanna, it's all yours.
Great, thank you, Leah, and thank you to all of our speakers. This was a great overview, and we look forward to sharing more about citizen science response to COVID-19, again with the webinar that Leah mentioned at the end of the month, and we should have more details on some citizen science resources for educators focused on those that are new to using citizen science for COVID-19. You can find out more information about our upcoming webinars and to register on our website. I'll share that link shortly, and I will follow up with an email probably early next week that has a link to this recording and also a compilation of all of the links that were shared. There was a lot of great stuff shared in the chat today, so I appreciate everybody contributing to that. And with that, thank you, and yeah, hopefully we'll see you at another webinar later this month.
Thank you, Reanna.